India, home to 1/5 of the world's population. Sweltering heat and humidity saturate most of the country. But as you trek up into the foothills of the Himalayas, where the small community of Pati resides, the air cools slightly. 4 students from Northwestern's Feinberg School of Medicine made that trek and found themselves living among the people of this remote village. Here, through the support of the Global Health Initiative, they are the latest Feinberg students traveling to underserved areas to seek knowledge and provide care.
We've been shadowing in the morning in the outpatient department clinic, seeing the patients that are coming in who are mostly from the Pati area.
There's one doctor, one small building. There's 2 rooms, one where the doctor sees the patients, and the other where the patients receive the medication prescribed by the doctor.
We did a health camp for patients who maybe can't walk all the way to the clinic. And we just set up in a local's home there, and then different patients from that area of the village came in.
He has a little bit of headache, and he asked, "Are you feeling anxious about anything?" She says no.
While the sights outside their windows may be beautiful, poverty and illness among the local population paints a far more stark picture. During the rotations, these students see only a small sample of the extreme health issues that are still far too common in so many areas around the world.
Thank you. We've been walking around this area to do a health survey to better understand the sorts of things that are impacting this population. We've been looking pretty specifically at anemia and malnutrition. It's very important for medical students to go on international rotations to see the different health concerns throughout the world and to just see different methods of healthcare systems in order to greater appreciate and understand our own.
Culture affects when someone thinks they need to go to the doctor, what kind of medicines they think the doctor should give them, how they actually take the medicines the doctor gives them.
In the past 10 years, more than 900 students just like these have undertaken global health rotations in more than 40 countries, including underserved sites here in the United States. In Central and South America, students are learning the value of developing their primary care skills. They live with host families to learn about the local culture. Working in the poorest of locations, places that time seems to have forgotten, they learn valuable lessons from local medical professionals and exchange their own knowledge in return.
Most of the programs are based on local strengths in the healthcare system. Therefore, for example, here the local strength is primary health care, preventative medicine.
You have a patient and then you get a blood test and you get a urine test and you get an ultrasound and you get an x-ray and you just rely on those tests to tell you what's going on. But here you see a doctor that has to go off what he sees, what he hears, what he sees, and what he touches.
So largely our focus has been on sorting out things that we can treat from those things that we can't treat. The model that we set up as medical students is the older medical students work with the younger medical students, so there's an opportunity to do some teaching.
Let's think about belly pain.
So she said something that feels like...
You do house visits to promote anti-parasite medicines, which are needed pretty much every 3 to 6 months for the people that live there because the water is unclean.
We saw a patient yesterday who had a blood pressure of 210/92 and had never seen a doctor about her hypertension.
It's really a pretty unique opportunity, and it's something that is really amazing that Northwestern has and that the Global Health Initiative has provided for us.
We exchange experiences, like we say how school is in the States for us, and the doctors tell us what their training was like, and I think that is what is so unique about this experience in particular, that we can share more than just medicine.
And so that human connection is something that doctors can bring to everyone, especially to the people in the most remote areas who never have that opportunity.
In Africa, students and faculty see a detailed picture of some of the most daunting medical issues in the world. Working with regional doctors, they learn not only about the local culture, but the local medical education system as well.
First few days, obviously, here in Uganda, were a bit of a culture shock. We saw things that we would never see back home at Northwestern.
It was definitely an eye-opening experience to see the little kids and the conditions that they have to live in.
Even today we were taking care of patients that we didn't necessarily know what was going on, but we had to figure it out, and I think that's something that's very important to know, that you will figure it out and things will be okay as long as you use your resources properly and use your knowledge properly.
I think programs like the Global Health Initiative help to set the stage for people that are at this point in our lives where we're still trying to figure out what role global health will play in our careers.
In the U.S., students also have opportunities to undertake rotations to underserved areas, from the west side of Chicago to Indian reservations in places like Wolf Point, Montana.
Good medicine is ordinary things done well, and that's what we do here. We're out here in the hinterlands, but what we do real well.
You know, obviously this is a great learning opportunity. We don't really often have any scenarios throughout med school otherwise to see practice continuity care, where we get to see patients over a longer period of time.
In addition to medical education and medical student global rotations, the GHI also focuses on research, funding a growing number of projects, such as those focused on HIV in South Africa and the Dominican Republic. There are nearly 40 million people in the world infected with HIV today, and 2 million new cases occur every year.
Almost 20% of South Africans are HIV positive. Most of the HIV is occurring in patients who have fewer resources.
So we started off talking about the science behind HIV, so the virology, the transmission, the infectivity, and then we progressed really to the clinical aspects of HIV, tailoring towards the primary care provider population that we were speaking to.
Through the work in Nigeria of Dr. Robert Murphy, director of Feinberg Center for Global Health, the death rate from HIV has been cut nearly in half in just 6 years. His work has also led to the development of a low-cost test for hepatitis C, saving more than 35,000 lives. The GHI, in a joint effort with Project Cure, regularly sends containers of medical supplies to multiple sites around the world, and is sending medical education materials as well to enhance the training of local medical students.
The container has been very, very helpful. It has really uplifted what we have. The school, we didn't have any books for school. Now students are so happy.
The Global Health Initiative continues to pursue new opportunities and locations for students, faculty, and researchers to learn about healthcare. In the Kenyan city of Dandora, women face a lack of access to quality maternal care in a town that is literally built on a garbage dump.
Dandora is an incredibly poor area. The city of 200,000 people was designed for half to a quarter that many and is built on a garbage dump from Nairobi.
My firstborn, I delivered him in Kenyatta Hospital. We were sharing one bed, 2 mothers. Other beds were sharing 3 mothers. There was no food at all, no warm water. I was shivering, no food.
A local foundation constructed a state-of-the-art maternal newborn medical facility there, and Northwestern's head of family medicine, Dr. Deb Klebens, is working to bring Northwestern residents to Dandora to help with the care of these expectant mothers.
Our hope with GHI Northwestern in Dandora is to bring trainees here, to bring residents and medical students here, to learn about the community, to learn about the environment and the challenges people face.
Only 1/5 of the world's population reap the benefits of modern medicine. And the illnesses affecting many of those not so fortunate sets up a cycle of disability and poverty, which is nearly impossible to escape. But today, real solutions are within our grasp. The benefits of programs like the GHI are palpable. Expanding medical education, providing care, and supporting innovative global health research. All these things are making a difference.
We have a caring and wonderfully supportive community and leaders who know how important global health is to everyone. 45% of our medical students make some trip overseas. We have faculty who are deeply involved in research on many continents. We have the infrastructure to make them successful. We know that if we can continue to build off of that, we can be agents for great change. We have a very clear understanding of how important this can be for the future of all of us.
But we still have more to do. Our goal is to continue to develop an endowed institute at Northwestern so that the health problems affecting billions of people today will one day soon be buried in the annals of medical history, replaced by good health and productive lives for every human being.